You have a problem in mastering Glasgow comma scale parameters, or the so-called aspects, or its components. Well, this is made easy for you. Well, Glasgow comma scale has three components or aspects. That is eye opening as the first one, usually abbreviated as E. We have the verbal response, the second one, abbreviated as V, and the motor response, abbreviated as M. And each of the three aspects have a total score. So eye opening has a total score of 4. So 4 being the total score of eye opening as an aspect used in neurological assessment in Glasgow comma scale. Similarly, verbal response also has a total score of 5. And lastly, motor response aspect has a total score of 6. And now we find that within each of the three aspects, the lowest score is 1. And each of the lowest score, the response is usually no response. That means that the patient does not react anyhow, does not show any reaction, does not show any behavior. So usually in each of the aspect, in each of the lowest aspect, the response is usually 1. The response is usually no response. So whenever you see 1 as a score, write it no. We write with eye response, we use the mnemonic spicy spinach. So to start with the spicy spinach, this is just a mnemonic that will help you understand the 4 components of eye opening. So we will take S here and the SB here. So S here is the spontaneous eye opening, number 1, and then we have the second S here, that is speech, response to speech, and the P here is response to pain, and the least score is number 1, which is always no response. Let's go to verbal response, where we have a mnemonic so-called oriented cows. So oriented here means the patient is well oriented, aware of the environment, just like a healthy patient or a patient who is not so much serious. And then we rush to cows. The word cows here, we will use C to mean the patient is confused, and the word W in cows will mean inappropriate words. And finally in cows, the word cows in comprehensive sound here will bring us to the score of 2. And as usual, the final score, which is the least score, the lowest one, is no response. Let's move to the third aspect, which is motor response, abbreviated as M. And here we use the mnemonic old wife. And here we will use the word OL, that is O meaning obey command, and L meaning the patient localizes, maybe to pain or to command. And then we come to the word wife, where W means the patient withdraws away from pain. And the third score from the word wife, where F here will stand for flexion, usually decorticate posture. Yeah, and the so-called E, the last letter of the word wife, will mean extension, that is the patient decelerate. And finally, the last score is no response. So the score number 1, or when a patient scores 1 in each aspect, in each of the 3 aspects, it will be no response. So always just remember the 3 sentences. In eye opening, just remember spicy spinach. In verbal response aspect, just remember oriented cows. And in motor response, just remember old wife. So finally, you will just have to score your patient as we do score. These mnemonics just help you to know what to fill in, what to assess from your patient. While finally, the maximum score for a Glasgow comma scale is 15, and the minimum score is usually 3. And the scores are in 3 types of scores that we give to our patients. Is the first one is mild, which means our patient has a score ranging from 14 to 15. Then we have moderate, which means from the 3 aspects, the total score is 9 to 13. And we have the so-called severe, when we say our patient has neurological damage or is severe or critically ill, the score will be 8 to 9. So from all the three aspects, you will know how to score your patient. Just remember the three mnemonics, the three sentences: spicy spinach, number 2 oriented cows, and old wife. Thank you for watching. Do not forget to share and stay tuned for another video.